Stop cancer. Play your part and help spread awareness and save lives. Pray for a cure. Know the symptoms. Get a mammogram. The Northeast Alabama Conference, Women in Ministry, presents Breast Cancer Awareness. October is Breast Cancer Awareness Month. Basic information about breast cancer. Cancer is a disease in which cells in the body grow out of control. Except for skin cancer, breast cancer is the most common cancer in women in the United States. Deaths from breast cancer have declined over time, but breast cancer remains the second leading cause of cancer death among women overall and the leading cause of cancer death among Hispanic women. Each year in the United States, about 255,000 cases of breast cancer are diagnosed in women and about 2,300 in men. About 42,000 women and 500 men in the U.S. die each year from breast cancer. Black women have a higher rate of death from breast cancer than white women. What is breast cancer? Breast cancer is a disease in which cells in the breast grow out of control. There are different kinds of breast cancer. What are the symptoms of breast cancer? Different people have different symptoms of breast cancer. Some people do not have any signs or symptoms at all. Some warning signs of breast cancer are new lump in the breast or under the arm, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area of the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size of the breast or the shape of the breast, pain in any area of the breast. Keep in mind that these symptoms can happen with other conditions that are not cancer. What is a normal breast? No breast is typical. What is normal for you may be normal or not normal, rather, for another person. Most women say their breasts feel lumpy or uneven. The way your breasts look and feel can be affected by getting your period, having children, losing or gaining weight, and taking certain medications. Breasts also tend to change as you age. For more information, see the National Cancer Institute's Breast Changes and Conditions. What do lumps in my breast mean? Many conditions can cause lumps in the breast, including cancer. But most breast lumps are caused by other medical conditions. The two most common causes of breast lumps are fibrocystic breast conditions and cyst. Fibrocystic conditions causes non-cancerous changes in the breast that can make them lumpy, tender, and sore. Cysts are small, fluid-filled sacs that can develop in the breast. What are the risk factors for breast cancer? Studies have shown that your risk for breast cancer is due to a combination of factors. The main factors that influence your risk include being a woman and getting older. Most breast cancers are found in women who are 50 years old or older. Some women will get breast cancer even without any other risk factors that they know of. Having a risk factor does not mean you will get the disease, and not all risk factors have the same effect. Most women have some risk factors, but most women do not get breast cancer. If you have breast cancer risk factors, talk with your doctor about ways you can lower your risk and about screening for breast cancer. Risk factors you cannot change include the following: getting older, genetic mutations, which are inherited genes. Women who have inherited these genetic changes are at a higher risk of breast and ovarian cancer. Reproductive history, early menstrual periods before the age of 12, and starting menopause after age 55 exposes women to hormones longer, which in fact raises their risk of getting breast cancer. Having dense breast. Dense breasts have more connective tissue than fatty tissue, which can sometimes make it hard to see tumors on a mammogram. Women with dense breasts are more likely to get breast cancer. A personal history of cancer or certain non-cancerous breast disease. Women who have had breast cancer are more likely to get breast cancer a second time. Some non-cancerous breast disease, such as atypical hypoplasia or lobular carcinoma, places women at a higher risk of getting breast cancer. Family history of breast cancer or ovarian cancer can also place women at a higher risk. And if you've had previous treatment using radiation therapy, this will also place women at a higher risk of developing breast cancer. And last, women who took the drug DES, which was given to some pregnant women in the U.S. between 1940 and 1971 to prevent miscarriage. They will have a higher risk of developing breast cancer, and women whose mothers took the drug DES while pregnant with them are also at risk. What can I do to reduce my risk of breast cancer? Many factors over the course of a lifetime can influence your breast cancer risk. You cannot change some factors, such as getting older or your family history, but you can help lower your risk of breast cancer by taking care of your health in the following ways. Keep a healthy weight. Exercise regularly. Don't drink or limit your drinks of alcoholic beverages. If you are taking or have been told to take hormone replacement therapy or oral contraceptives such as birth control pills, ask your doctor about the risk and find out if it is right for you. Breastfeed your children if possible. If you have a family history of breast cancer or inherited changes in your genes, talk to your doctor about other ways to lower your risk. And lastly, staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving cancer if it occurs. What is breast cancer screening? Breast cancer screening means checking a woman's breast for cancer before there are signs or symptoms of the disease. All women need to be informed by their health care provider about the best screening options for them. When you are told about the benefits and risks of screening and decide with your health care provider whether screening is right for you, and if so, when to have it. This is called informed and shared decision making. Mammograms are the best way to find breast cancer early, when it is easy to treat and before it is big enough to feel or cause symptoms. What is a mammogram? A mammogram is an X-ray picture of the breast. Doctors use a mammogram to look for early signs of breast cancer. Regular mammograms are the best test doctors have to find breast cancer early, sometimes up to 3 years before it can be felt. So how is a mammogram done? You will stand in front of a X-ray machine. A technologist will place your breast on a plastic plate. Another plate will firmly press your breast from above. The plates will flatten the breast, holding it still while the X-ray is being taken. You will feel some pressure. The steps are repeated to make a side view of the breast. The other breast will be X-rayed in the same way. You will then wait while the technologists check the 4 X-rays to make sure the pictures do not need to be redone. Keep in mind that the technologist cannot tell you the results of your mammogram. Each woman's mammogram may look a little different because all breasts are a little different. But regular mammograms are the best test that doctors have to find breast cancer early. How is breast cancer treated? Breast cancer is treated in several ways. It depends on the kind of breast cancer and how far it has spread. People with breast cancer often get more than one kind of treatment. Surgery. This is an option where doctors cut out cancer tissue. Chemotherapy, using special medicine to shrink or kill the cancer cell. The drugs can be pills you take or medicines given in your veins, or sometimes both. Hormonal therapy. This blocks cancer cells from getting the hormones they need to grow. Biological therapy works with your body's immune system to help it fight cancer cells or to control side effects from other cancer treatments. Radiation therapy, using high energy rays, similar to X-rays, to kill the cancer cells. Doctors from different specialties often work together to treat breast cancer. Surgeons are doctors who perform operations. Medical oncologists are doctors who treat cancer with medicine. Radiation oncologists are doctors who treat cancer with radiation. This content has come from the Division of Cancer Prevention and Control, Center for disease control and prevention. Thank you for joining us on this broadcast, Breast Cancer Awareness.